Good afternoon, Dr. Adam Childers, and we're back with another educational FaceTime video. Thank you for joining us on this beautiful late summer afternoon. We have been getting inundated with multiple phone calls. In fact, to the point our phone system is not able to even handle it. So my goal today is to try and help you get a few questions and save you some frustration in the process as far as being stuck on a phone that then dropped you. I've been there, I understand, nobody likes that. All right, so let's start out with subject number one, vaccines. Everybody has their own opinions on them. I will tell you, do I think vaccines are important? I do. I think vaccines are going to be important to help us control COVID and its success. I'm going to leave it up to you to decide which vaccine it is that is best for you. There are places to do your research. Those places include things like the CDC, NIH, and the VAERS registry looking at side effects. Educate yourself, visit with the providers that you know, that you trust, your primary care provider, and then make the decision that you feel is best for you. That's my advice on that. That's the same advice I give people when I get asked this question all the time by family members, friends, and others. There are vaccines available in the community. Pal Drug carries Moderna. Public Health has a couple variations. I believe Walmart and Walgreens and Cody also has some. And again, the Public Health Office knows who's carrying what in the county, so you can get them if you choose to chase that avenue. Next, our website does have information with a series of multiple links to different sources so that you can look at both questions regarding vaccines, but also regarding your symptomatology. When do I go to the hospital? There's a lot of good information there and on symptom management. So take advantage of the website here at pvhc.org. Choose other websites. Any of your major hospital organizations will have the most reliable information that we have for you, as up to date as we can get it, for you to help yourself and get good information. Next, it's important to understand that nobody in this region is doing asymptomatic testing. So if you're looking for a test because somebody says you need it, no hospital or clinic has that capability or option available to you. My recommendation would be consider contacting the state or looking at the State of Wyoming website, see what they may or may not be able to offer you. As you can tell, I haven't done that today. I can't tell you what options are there. As far as symptoms, let's talk about the warning signs, because the people that have asked me, hey doc, do I need to go to the hospital? That's their concern. Do I need to go to the hospital? The big things you need to worry about is your work of breathing increased. That's doctor talk for do they look sick, right? I mean, if I'm huffing, puffing, their lips are turning blue, they're breathing 30, 40, 50 times a minute, that's work of breathing. Usually that they flunk the eyeball test, right? That's somebody that looks ill. Other signs are blue lips. If you have a pulse oximeter and it's consistently that 89, 90%, that would be a time to contact the clinic to schedule an appointment, or potentially the emergency room, depending on the scenario. That would be a time to try to call in, visit with one of the nurses, and get a recommendation to help you that way. Things such as fever, diarrhea, muscle aches, and cough. Again, sounds just like the flu, right? Just like the flu, unfortunately, there's no magic pill for this other than a tincture of time and symptomatic. Use your Tylenol for fevers and body aches, for example, and these type of simple over-the-counter solutions that we use for everything else. Sometimes we have to just remember COVID can be scary, and when we have the diagnosis ourselves, it can be scary. But let's go back to the basics of what I do for any viral illness, bad cold or flu type thing that has me ill but not quite dying ill yet, where I'm feeling super sick. So those moderate symptoms, again, use your over-the-counter symptomatology. You're welcome to try to get an appointment to come in. We're happy to see you, but you're going to go home with the same advice. So This way we can free up the clinic time, ideally for those people that are a little sicker, trying to figure out, do they need oxygen, do they not need oxygen, and other therapies that might be appropriate for them. And it saves you some time sitting in a waiting room or other locations for your chance to be visited. I hope this is helpful to you. We may have a few more of these videos coming out as information gathers. The other thing I'd like to remind you is, yes, COVID is definitely on the increase, both in Powell and Cody, as well as our neighboring counties around us. So please use common sense. Protect yourself, wash your hands. The basic things that we've all been taught since we're small children in keeping ourselves healthy and strong. It will go a long ways. Look out for your neighbors. Let's help one another. I can tell you that the staff here at PVHC, it's an honor and a privilege for me to be able to get to work with these fantastic nurses, radiology lab. They are dedicating all kinds of time. They are sacrificing time away from their family to take care of those that are here. And unfortunately, those numbers have crept up in our area compared to several weeks ago. So let's hang in there. Let's be patient with one another, and remember, we will get through this if we keep each other's backs. Thank you.